for everyone that is watching, and there's millions right around the world watching this, I think, what are some of the key points in preventing bowel cancer? 3, 4, 5 points. What are the things you would tell everyone?
The two main sets of points are firstly keeping yourself healthy and then participating in a screening program, because they're the two things that you've really got to do. And in terms of keeping yourself healthy, it's all the sorts of messages that you talk to people about all the time. Making sure that you exercise regularly and that you eat well, not too much processed food, and that you keep yourself at a normal body weight. Because we know that the moment your body mass index starts to creep up above normal, your risk of a whole lot of cancers is increased, and bowel cancer is one of those cancers. So we're really keen that people try and keep themselves in reasonable shape. The other things that are really important are not smoking. It's just such a recurrent message with all of these health issues. If you smoke, you're gonna die early. It's as simple as that. So people have just got to get that message on board. And most people enjoy a drink. I enjoy a drink, I'm sure you do.
Moderation.
Moderation is what it's all about, Shane.
Do you know the word that I love using?
What's that?
Balance. In life, in drinking, in eating, in everything you do. Do you like that word, Professor?
Yeah, I'm very big on balance, and you certainly don't want to drink so much that you lose your balance. And the point is, there's nothing to stop anybody having a moderate amount of alcohol. That's not bad for you. But what we don't want is people drinking to excess. So looking after yourself is important.
Is it everyone has to have a colonoscopy? Is that how it works?
Not sure why you get nervous about the colonoscopy, Shane. I think that that'd be right up your alley.
Well, it was right up my alley. But is that how you test pretty much everyone, or is there different ways to test?
Not everybody needs a colonoscopy. In fact, there's only about 10 or 15% of the population that really need to have a colonoscopy. For most people, all they need to do is get one of these little poo tests, fecal occult blood tests, and all they do is take this home and have a little bowel action into the toilet and take a drop of water out of the toilet, put it onto a slide and send it off in the mail. It takes about 5 minutes, and what that does is it picks up blood in their stool. I was hoping we'd get you to demonstrate this today, but you've declined.
I went earlier, so sorry about that.
Well, all you do with this, you get your little brush, you have a little poo in the toilet, take a drop of water from next to the poo,
And that's it.
all you got to do, you just pop it on that little slide and you send it off in the mail.
And not only free, it will save lives by doing this.
Absolutely, yep.
Because you can get on top of it early,
Yep.
and then you obviously can beat it and live a long and happy life.
Well, the premise with doing this kit is that we want to pick up these cancers before they become cancers, when they're still at the polyp phase, because virtually every bowel cancer comes from a precancerous polyp, which is just a little lump in the bowel. And it's really, really simple to treat those, detect them and remove them. So not only are we trying to treat bowel cancer early, but we're trying to stop people from getting bowel cancer at all. And that's a really achievable goal in Australia.
I like your certificates.
Do you like those? You can borrow them if you like.
Did you get them off the internet? Like, did you
Yep.
make them yourself?